Governor Mark Dayton says he will undergo surgery next month to treat his prostate cancer.
The governor met with Mayo Clinic doctors last week who told him the cancer was caught early and has not spread. He says he'll likely spend one night in the hospital and will continue to govern during his recovery. In a statement on his personal Facebook page, the governor said, "Many friends and strangers have shared with me their experiences dealing with prostate cancer. You've lifted my spirits and given me both hope and resolve. I'm deeply grateful to you." Prostate cancer is one of the most common cancers. 1 in 7 men will be diagnosed with it in their lifetime. And many will be faced with the same choice the governor had, whether to treat the cancer with radiation or surgery. Esme Murphy spoke with a leading expert about the options men have and key factors in choosing a treatment option.
In the aftermath of his cancer diagnosis, the governor has been upbeat.
I feel totally capable of doing the job to the very best of my ability, and I intend to do so as long as I know that I'm capable of doing that.
The governor wrote on Facebook he will undergo surgery on March 2nd at the Mayo Clinic in Rochester and will spend one night in the hospital.
I expect to be able to very quickly, within a matter of just a couple hours, resume my normal duties, responsibilities.
Dr. Kendall Faya, who performs prostate surgeries at Hennepin County Medical Center, says a full recovery can take up to 6 weeks, less if the surgery is done with a less invasive robotic procedure.
I usually tell my patients that God put the prostate in a spot where it wasn't meant to come out easily. So it's got a lot of attachments, and it's near a lot of things that are very important to every man.
Dr. Faya, who is not involved with the governor's care, says the surgery itself takes an average of 4 hours. Governor Dayton is choosing surgery over radiation, which has its own downsides.
It's usually about 42 treatments to get radiation. For almost 7 weeks, you have to come in and get a treatment essentially every day.
The governor, whose cancer was caught early, says his doctors are optimistic.
I think I'll have an excellent final outcome.
And outcomes for prostate cancers like the governor's that are caught early and have not spread beyond the prostate are excellent. The 5-year survival rate is almost 99%. But
Wow.
again, Amelia, the key here is that early detection and treatment.
And he had early detection. So.
Absolutely, very early.
All right. Thank you, Esme.